Welcome everyone to our very special edition of An Evening Conversation. This night is very special because, as we all know, the vaccine has finally come out. But I'm sure, as I have had many questions, I'm sure a lot of people, all of you have lots of questions. And so the reason for this panel is to have those questions answered. And with that, we are going to go with our first guest, who is actually not listed in our introduction because she's a very special guest. Her name is Wanda Walters, and she has a very personal story about COVID. So I'm going to pass it over to Wanda Walters and putting a face on COVID.
Hello, everybody. I'm Wanda Walters, and thank you so much, Millena, for having me. We're all fam. Before I begin my story, I'd like to give just a little bit of a background. I am the oldest daughter of four of Dr. Wendell and Susie Butler. I have three sisters, Karen and Carol, who are twins. They were online today, and the younger sister, Susan, and she's online as well. I live in Maryland, Karen in Kentucky, and my parents, along with Susan and Carol, lived in Roanoke, Virginia. My father was a retired dentist, former vice mayor of Roanoke, and served on the board of numerous government agencies, and was very active in his church and his fraternity and just numerous community organizations. Carol and Susan have been my 96-year-old parents' primary caregivers for about a decade, and they've just always done such a stellar job and are truly a model of home care. But now I'm going on quickly to COVID. This fall in October, my dad's 96th birthday was October 12th. So I did my annual trek down to Roanoke on the 9th. When I got there, I received a call that, people were a little bit under the weather. My mom was sick, but she was somewhat frail. My dad had had a flu shot, so it wasn't unusual for him to be under the weather for a flu shot. And, it was flu season, so we just thought everybody had the flu because everybody had been so very, very careful. When I arrived there, I just noticed that things were really deteriorating. And then on Sunday, the 11th, it was determined that my mother should go to the hospital. As routine, they did a COVID test, and she was positive, and we were just totally shocked. But although they said asymptomatic, she was still in pretty bad shape. Around the same time, my sister Susan was getting quite ill. She wasn't eating, she was very tired, and persistent cough. And so she was dealing with that. And then my father was also each day, almost by the hour, seemed to be getting weaker and weaker and weaker. And my sister Carol was getting sick, and it was like you're watching everybody just kind of getting sicker and sicker and sicker. It's kind of frightening when you're so used to everybody being healthy, and then everybody's getting sick right in front of your eyes, and you can see the deterioration happening almost hourly. But my dad, very social person, I had planned a little Zoom thing, birthday party for him. And, even though he was laying down, not feeling well, I said, well, do you want me just to go on Zoom and tell everybody you don't feel well? And he said, oh, no, I can do it. So he did do that. On that Monday, which was his birthday, he was really sick. I mean, this was a person who could take care of himself, take care of feeding, clothing, dressing, sharp as a tack. He was even so sharp, he wanted to make sure he voted early. So he got that taken care of, especially this election. And, but he was getting weaker. So on that Monday around 4:00, we decided he should go to the hospital. And so the ambulance picked him up, and I stayed with him. Carol stayed with my mom the day before till about midnight. And I stayed all night because they didn't have a room in ER with him. And he was very nervous and frightened. And a strange thing about ER, there's no support. So, I had to handle the urinal. I had to handle food. I had to handle everything. His nebulizer, he has COPD. And So that morning, they did find a room for him, and I left and I said, well, let me go get a COVID test. Oh, because they did test him too and say, oh, by the way, you have COVID. And again, we were totally stunned. And I only had my little cloth mask. And the morning when the doctor came in to check him and say, get him ready to go to the room, he did say, you probably have COVID now too. But I went to, and I got the test, and I felt fine. I felt great. I just left. I felt perfectly fine, and just went about my normal activities. And then, but my mom was continuing to decline. Susan was getting sicker as well, and Carol was getting sicker. So pretty soon, mom and dad were there, and pretty soon Susan followed. And so there was the three of them there for a while, and then it became obvious that my mom probably was not going to make it much longer. And so, but Susan and my dad were able to spend some really special time with her in the hospital. And then I think on a Friday she came, there was a call that she was going to come home, and then Carol, who is such an angel, stayed in the room with her all night long that last night. But unfortunately, she got oversaturated with COVID as well. So that Saturday, mom did pass away, and Karen was on her way from Louisville. She flew in, and so she was there, and she was able to visit with mom before the funeral home folks came. Then we decided we probably should get the house disinfected. So Karen and I went to a hotel, but I started not feeling well either. And that's unusual for me. I'm a runner. I had run 6 miles that a couple of days before, and then suddenly I couldn't move. And that was very odd. And then finally on that Thursday morning, unbeknownst to me, Karen said I had a seizure. So 911 was called, and we went to the hospital. And first the COVID tests, I came back, was a rapid test, said negative. But they decided to keep me because there was some pneumonia, and there was the seizure, and just thought I should be observed. And then later on that night, about midnight, they said, oh yeah, you do have COVID after all. And also the day after my mom passed away, Carol was also getting weaker, and her husband, Steve, took her to the hospital. So she was in the hospital. My dad was in the hospital. I was in the hospital. So 3 of us were in the hospital. Susan had been released shortly thereafter. So we were able, Carol and I actually ended up being roommates, which was kind of nice. We hadn't really shared a room since we were kids. It was kind of dire situation, and we got to visit my dad often. And then I was released fairly soon. Fortunately, I didn't really have any breathing difficulties, or I never was hooked up to a syringe or anything like that. So I was there more for observation, and I think just because of my age. So I was released like maybe 4 days later, but during all of this, while my mom passed away, Karen had to handle the entire funeral arrangements pretty much by herself, because the rest of us were in the hospital and sick. And, we couldn't be there. We couldn't go to the funeral home. It was just surreal. So fortunately, going back to my dad, he did have an iPad with him the whole time. So we were able to see him, and he was able to communicate, and he really seemed to enjoy that. So when I got ready to come home after about 4 days, the doctor came in right as I was preparing to leave and said that our dad was taking a turn for the worse. And so that added another whole stressor. But Carol probably got hit the hardest because she was the kindest and stayed with my mom that time, and so she really got just oversaturated with COVID, and she had to be on oxygen, but she came through okay. And so after a few days, my dad came home, and his granddaughter's Kim, Karen's daughter from Kentucky, and she's a physical therapist, and Lauren, Carol's daughter from Atlanta, she's a nurse practitioner. and they came and just provided stellar care. I mean, you know, you couldn't pay for care is that well. And so our dad passed away on November the 5th. So right now, as we're going through, a lot of different emotions come through, but one thing I do feel very, very grateful in many ways. All three of us, there are 4 girls, we're all healthy now. Everybody's back to normal. Everybody's now training for 5K. You know, we're in a little Strava group, and we're, you know, seeing who can clock the most miles, and we're doing really well. Karen felt that she had COVID during the summer, so she was immune. And so, you know, she was like the one who was like everywhere doing everything. I feel very grateful that I had both of my parents, who were wonderful parents, for 70 years. I'm 70 years old, so not many people get to have both of their parents for 70 years. My dad never wanted to be incapacitated. He was a very proud man. He was very independent. He was alert. He watches CNN, MSNBC, and even watched Fox News so he can know what other people were thinking. I don't know how he stood that, but he did it. But when he, I think, realized things were happening, he actually told the medical staff to unhook everything he was done. And they called us on the iPad, and you know, that was pretty hard to actually watch the medical staff unhook everything. But you know, it was on his terms, and so that was good. And the last thing, I'm very, you know, I have a wonderful family, a husband, a son and daughter. My daughter and son-in-law are actually on the panel tonight. And my first COVID vaccine is scheduled for February 16th, and the second dose is scheduled for March 9th.
So I just want to ask you, just for everyone to understand, thank you for sharing all of that. So in between the time frame of the birthday party and how everything transpired, what amount of time was that?
Oh, I got there, let's say October the 9th, and my father passed away November 5th. And so it was like within a month, you know, everybody was hospitalized, you know, our parents passed away.
Within a month. And can you share with everyone, now I know how protective, like people, you guys weren't going out to Walmart or the store or anywhere. You were very, very diligent about being, you know, protected, because I'm sure that's what everyone wants to know. You probably didn't have masks on. You probably weren't washing your hands.
No, we all had masks on. Everybody was masked. They were very, very careful. You know, it's just one of those things you will never know. You will never know how. I mean, there were caregiver coming in. You know, you don't have control over everybody all the time. You know, you do have to go to the store sometime. I mean, you just don't know, and you can't really beat yourself up about it. I mean, it happened. And so we just don't know. We just don't know. I mean, I know I got it in Roanoke because I was fine. And then I kind of went in. But, you know, the Roanoke folks, you know, they did everything that they were supposed to do.
Yeah. And it still happens. And that's why
sometimes stuff happens.
Yeah, and that's why I wanted you to share your story, just so that everyone out there knows that just no matter how careful and how much you try and wear your gloves and protect and social distance and all of that, you still never know. It still could happen. And especially now with these variants, you know, we just don't know what's going on. So as we go forward. So thank you for sharing your story, and thank you. And we're getting a lot of comments in the chat about how heartbreaking, and just thank you for being so honest and transparent. Our hearts go out to you and our family. So I'd like to begin on that note with our panelists. Now, our first panelist is Dr. Roshonda Clemons. And Dr. Clemons, she is, as we shared, she is an OBGYN, and she does not believe in any vaccines at all, for herself or at all. So Dr. Clemons, would you just take a few moments and speak a few words?
So good evening, everyone. I'm Dr. Clemons, and I'm actually a board certified pediatrician. And I do believe in vaccines. I actually believe strongly in vaccines as a board certified pediatrician, but I believe in safe and effective vaccines. And so first, Ms. Walters, I want to say thank you for sharing, and my condolences to you and the rest of your family. This has been very turbulent and trying times for all of us. But I just have to be very clear when I say I believe in vaccines, but they have to be safe and effective. Just to let you know, for my own little ones, I started vaccinating them at 6 weeks. I didn't even wait for them to become 8 weeks of age or 2 months of age. I started at 6 weeks. And so I know I may have more of an unpopular perspective on this vaccine, and at least if it's not unpopular, is one that many don't feel comfortable sharing, because the reality of it is that, you know, half of the medical community is on board and half is off. And sometimes the media takes hold of things and they run with it. And for me, I've been practicing for, you know, I've been a physician more than a couple decades. So I've seen a whole lot. I've been practicing prior to them even having the varicella, the chickenpox vaccine out, practicing way before HPV vaccines came out. So before we even had acellular pertussis. So I'm getting very technical, all of which to say is I believe in practicing evidence-based medicine. And so my job as a physician is not to coerce you into doing something that you don't feel comfortable with. My job is not even to tell you what to do or not to do with your body. But I feel that it is a moral, it is a spiritual, ethical, and professional responsibility for me to share the truth. And so there's a lot of information out there, and I know it's very difficult for people to be able to tease out what the truth is, how much of it is just sensationalism, who to trust, who not to trust. And so my perspective on it is that with anything that you do, any medication, including vaccines, you always want to weigh the risk versus the benefits. So for those who have high risk factors, anything that's going to compromise your immune system, that would interfere with your ability to fight this type of virus or any other viruses out there, then perhaps your benefits are going to far outweigh the risk of taking the vaccines. But for those who don't necessarily have those high risk factors, to expose the body to something that we don't even know about, because that's the reality of it is, you know, coronavirus has been around for a long time. We just don't know very much about this strain, but we don't know. And there's so many different variables. And as a board certified pediatrician, I have to know vaccines like the back of my hand. I'm talking to parents constantly about side effects, you know, expected side effects, normal side effects, adverse reactions. And so to have the responsibility, be charged with the responsibility of telling someone that you should take something that we really don't know much about and add to it the form of vaccine that we're doing, which is mRNA. We have no experience with that in terms of using it as a preventive measure. We have kind of dibbled and dabbled in that in terms of using it for treatment for oncology, cancer patients. But in terms of for vaccines, we haven't. And so definitely when it comes to the children, just for example, in one of my offices, we are involved with a study of a vaccine that has been out for several years. We're just trying to test and see whether or not we can use it for a younger age group. We've been doing this test for studies, and not just our office, but all around the entire country. We've been doing it probably 2.5 years, and we're about 60% through. And that's with a vaccine that we're fully aware of, but we just want to change the age group. So this is how serious I take vaccines especially when it comes to children. And when you throw in all those different factors in terms of, it's a new form of it, we don't know short-term, long-term, major complications, we just don't have that information. I can't tell you not to take the vaccine, but I also can't tell you to take the vaccine. I'm just saying, make sure you do your due diligence and you feel comfortable with the decisions that you're making for you and for your family.
And that's the whole reason for this particular town hall, so that everyone can have the full information to make the right decision for themselves and for their family. And we do have a lot of people who are against vaccines for various reasons and who are for vaccines for various reasons. And we have some people in the middle. And as I said, it's all about giving the information. There was a question that we'll get to later in the Q&A, and it had to do with something about herd immunity, but we'll get to that in the Q&A. But thank you for giving your perspective. I do have one quick question for you. Have you had any experience personally with any of the COVID vaccine? Any of your patients with directly the COVID vaccine?
Actually, I have a few colleagues who've actually taken the vaccine, staff that have received the vaccines, and everybody's done perfectly fine. They haven't had anything outside of the side effects that they actually publicize in terms of the, temporary lethargy or the pain directly at the site of the injection. And a few headaches, but nothing that's lasted longer than 72 hours. And I know in terms of the information is out there, Pfizer's, I think that one is publicized as, and I'll let some of the doctors that's been doing the research on it, but for the documents that I've researched, Pfizer's, have a little bit more side effects than the Moderna. But in terms of the people that I know directly who have received the vaccine, they have done perfectly fine.
Okay, well, that's good to know. And that actually segues into, thank you very much. And that actually segues into our next guest, and that is Dr. Katherine Walters Conte. Hi, Katherine, are you there?
I'm here.
Okay, so Katherine has volunteered, she volunteered to be a part of the Moderna vaccine trials this past fall. And we'd like to hear your experience in actually taking the vaccine, any hesitations that you had, and any colleagues or what you personally have experienced with it.
Yeah, great. So first I'll kind of talk about my motivation for taking the vaccine. When COVID-19 started, you're watching basically your whole life fall apart around you. My kids are home from school. I'm working from home. There's no daycare. Everything that we kind of had was just kind of, we still had our home. We still had our health. Fortunately, my husband and I have the ability to work from home. But, it was just hard. You're in constant fear of, what happened to my mother. My mother's Wanda Walters. So, that's my biggest fear. And so for me, it was kind of like, being called up to, the military when people say they want to go into the military and be a hero. I was just watching what's happening and being like, what can I do? Is there anything I can do? What can I possibly do? And I know that, in the past, there have been a lot of concerns about representation in vaccine trials or any sort of medical studies. So I'm a biologist by trade. I don't do infectious disease research, but I do genetic research. And so there's been a lot of issues with, all sorts of genetic research and whether there's representation and how they're getting people to, consent to things and that sort of thing. And so I thought it was really important for me as a Black woman to, be a part of this effort because I just saw how much it was devastating our community in particular. So I signed up. I think I saw like something on Facebook or maybe someone emailed something, that said like, oh, sign up for the vaccine here. And so, I filled out some form online, and didn't really think too much about it. And then a few months later in September, they contacted me and I felt like I'd won the lottery. I was so excited. And I was like, yes, I'll do it. And so, you know, right before I went in to kind of do all like, you know, my initial physical and all the consent and all that, I did start to hear stuff about, you know, side effects and you know, and it was kind of one of those things, you know, it's like little things and, you know, you hear it like in, you know, kind of mainstream media. So I was like, let me just check it out. And I kind of read, you know, in more detail, you know, you always have to go beyond the headlines. And I read it and I was like, okay, like that's nothing I can't handle. You know, and I've been in vaccine trials in the past. So, you know, I wasn't particularly scared or anything like that. So I went in and I got my first shot and, you know, you had to sign all sorts of paperwork and whatnot. So I got my first shot. I actually didn't feel anything after the first shot, except for I think maybe a few days later, my arm hurt, or like it was hard. Like I'm a side sleeper, and I couldn't sleep on that. I couldn't sleep on that side. So that was just kind of annoying. But I actually thought I got the placebo. I thought that was actually just the shot. So I actually thought I got placebo, and I was kind of disappointed. When I and then
Now,
actually. Go ahead.
Oh, I was just going to cut you off because you didn't feel any side effects. Is that why you thought you got the placebo?
Yeah, I wanted to feel side effects. Yeah, because I wasn't that was working. I didn't want to get the placebo. I wanted to get the real deal. And then I got the second shot. Actually, you know, while everything was happening with my mother and my aunts and my grandparents, is when I got the second shot. So I mean, they call you and say, "Do you want to continue?" And I was like, "Yes, I want to continue for sure." So after I received my second shot, so it was Moderna. And so I received my second shot about 4 weeks later. And I remember it was Halloween and I like woke up in the morning and I had like some back pain. And then I was like, that's weird. And then I was like, what's going on? I was like, oh, it's the vaccine. And I was like in pain, but also really excited. So I was like, it's working, it's doing something. So, you know, I just took some like children's Tylenol because that's all we had in our house. I took a nap, which I'm not a daytime napper. And I took like a nap around 2 o'clock. And then I was a little groggy for the rest of the day, but, you know, I felt fine the next day. You know, I mean, so for me, it was just something I really had to do. You know, I always, you know, my comparison is that, you know, I was able to feel better with Tylenol and a nap. My mother had a seizure and was in the hospital. You know, she did explain, despite the fact that she's 70 years old, she's actually a marathon runner and had just, you know, gotten off a stint as a half marathon coach. So a really healthy person. So just to see how someone, you know, that healthy could go down, you know, I didn't want the risk. I'd rather just take some Tylenol and nap and be fine. And so they did unblind me actually this week. So it's still, I didn't really know if I had a placebo or not. So they did unblind me this week on Wednesday and told me like, yes, you did indeed get the vaccine. So I was very excited about that. Yeah, that's my story with the vaccine.
Okay, thank you for sharing. Thank you for sharing. We do have a question, but we will get to that at Q&A. And our next guest, Crystal Antoinette Graham. She has a Master's of Science degree in Library Science. And Crystal is going to talk about how it is so important to do your research and to verify your sources. Because I know a lot of times we see things on YouTube, we see things on Instagram, and especially on Facebook, and oh, this person said this and this person said that. And you know, a lot of times it's not even true, because we all know the internet, you can find whatever you want, something positive and something negative about the exact same thing. So Crystal's going to speak about how important it is being a patient advocate and how important doing your research and checking is. Crystal?
This conversation started during our family day, as Katherine said and Wanda shared. You know, many of us are actually related, which is pretty phenomenal. The representation or the breadth of expertise that we have in our family. But at any rate, we were talking about COVID during our family day Zoom party, and I just was like, I'm sorry, I have to pause. Because, you know, I'm a librarian, being information savvy is my job. And I can never leave a room knowing that I could have shared some information and I did not. And so I kind of paused and I was like, hey guys, you know, I just want everyone to really be sure that you take information gathering during COVID very seriously. COVID, the information has just really been a minefield. I shared a story. So again, I'm a school librarian, and I do lessons all of the time on teaching the students how to identify accurate information online. So a particular lesson, I use an example of someone who had posted on Facebook about how their aunt had passed away, 2 days after taking the COVID vaccine, and I posed it to the children. I said, well, how would you feel if you saw this come up on, your Facebook or your Instagram feed? And they're like, yeah, I'll be worried. And this is why I'm not taking the vaccine. And, they had all these emotions. And I was like, well, let me just share with you that this story is completely made up. I did some fact checking on it. It turns out the state that the woman was living in, the CDC and the health department had investigated her story because it had been circulating so much. They said no one in the entire state had died of the COVID vaccine, and the story was 100% false. And I brought that story to the students, and I'm saying that now, just because it's very indicative of how easy it is to believe personal testimony. When something appears that it is being presented from someone's personal experience, we sort of turn off our critical thinking about that information. And that's really dangerous and worrisome, especially when it comes to information regarding health, right? And so what my biggest thing that I wanted the students to take away from, and then everyone listening to this panel presentation, is that the same way that if you saw an article proposing facts about a topic, and it didn't have a name on it, right? It didn't say who the author was. It didn't have a date. It didn't give the author's credentials. It didn't give you any information. It was just like some paragraphs on a white sheet of paper. You wouldn't believe it. Take that same skepticism to the things that you are reading on Instagram, on Facebook, on just websites that are not from national news organizations or national health organizations, because it is so easy for anyone to post information online. And again, I don't even think that it's malicious, right? I don't think that the people who are sharing this are doing it with malicious intent. They are seeing it as, oh, someone shared this personal story, so I'm going to share this personal story. But the problem is, I got it not from Millena, but let's say I got it from Millena, and I'm thinking it's a story about Melena's aunt, right? But it's not. It's another story that Millena thought that it was about her friend's aunt, and that friend thought it was about their friend's aunt, and so on and so forth. And we just believe it because it appears to be a personal story. And as human beings, like, we want to believe what other humans are saying, especially when it is in the form of compelling personal storytelling. So just again, to encourage you, I love that we started off with the perspective of not taking a vaccine. That is not my current perspective, but I just love the fact that you can still do research, you can still do your due diligence and come to a different perspective than I have, but just to be very careful that you are going to sources to get your information that are valid. And again, I always say my go-tos are the CDC, health organizations, World Health is another good place to get information, and also national news sites that tend to be unbiased in their reporting. So that would not be all of them, but many of them.
That's true. That's true. Okay. Thank you, Crystal. Thank you for
No
that
problem.
information. Thank you. And we do have another guest, Dr. Curtrina Strozier. She's an OBGYN, and she has received the COVID-19 vaccine. I'm not sure if it's Moderna or Pfizer, but she directly has received it, knows the day-to-day experiences and struggles of her patients, mothers and babies who have taken it. And Dr. Strozier, are you there?
Hi, I'm here.
Okay. Hi there. So can you share with us, so you have your patients, mothers and babies, have taken the vaccine. So can you share your perspective on it, please?
So let's be, I'd like to clarify a few things. First, I have personally had the vaccination. I had the Pfizer vaccination.
Okay.
And I have had both shots. I had the initial shot in December, and I completed my course on January 7th. Similarly to what others have explained, very minimal symptoms. The initial vaccination, I didn't feel anything on the day of. It was the second day that I felt a little arm soreness, and it was resolved within 24 hours. I got the second injection on day 17, which for the Pfizer, you get it either between day 17 and day 21 for your second dose. And I had a little more arm soreness. You could choose either arm, and I chose to use the same arm. As an OBGYN, I'm also a surgeon, so I use my non-dominant arm to have my vaccinations. So current states, and it may be different for different states and different hospital systems, right now, only your 1A, which are going to be your first line workers, are going to be the people who are available to have the vaccination. Here lately, they're going to probably open that up to your teachers and other people that are in close communication with a lot of public places. But right now in our hospital system, just the physicians, the nurses, the other ancillary healthcare staff can receive the vaccination. Now, with regards to my patients and their infants, there are no patients at this time that have access to this vaccination unless they are a healthcare worker. I get a lot of questions from my patients who are currently pregnant about what my advice is. And I am very firm with the stance that ACOG, and which is American College of Obstetrician and Gynecology, as well as our reproductive national guidelines. And the guidelines are that right now, there is just not enough data to support or defer someone from having the COVID vaccination during pregnancy. At the end of the day, we want safety. Safety is first and foremost. But in cases where I have moms who are obese, diabetic, might have other risk factors such as asthma, and they are frontline workers, do I prefer them to get sick with COVID and be pregnant? It's no. So I think like just with anybody is making a really educated decision based on your own personal risk factors, your possible exposures to COVID, and it really is a difficult decision to make. If I were pregnant, I think the biggest risk for any pregnancy is miscarriage in the first trimester. And right now, I have seen some animal study models in other countries that are conducting studies, and they have shown a slight increased risk in miscarriage. It has not been reproduced consistently because there's just not enough data. There is, however, a data pool that if there is a pregnant woman who has gotten the vaccination, that they would like your information. So please share that. Also, if you got the vaccination and later become pregnant, please know that there's a huge need for that information. So please share. But I really want to thank Ms. Walters for sharing her story. I see so many patients that have so many stories very similar. When we look at this disease, we were all blindsided by this. 2.2 million people worldwide have died of COVID. In the United States, our statistic is 440,000 US citizens have died from COVID. Yes, we are all worried about different side effects. I remember walking in, and yes, when you get this vaccination, there's a huge packet of papers that you have to sign. I'm like, oh my gosh, I'm signing my life away. Let me clench my pearls. What is going on here? Honestly, I had palpitations walking in. So I probably walked in like this and just like hold my breath. I was grateful for a mask because I probably was doing one of these numbers. But I had to also say, I personally feel like if I got COVID, I had very minimal risk factors because I'm young, relatively healthy, no respiratory issues, no other risk factors for getting a really severe case and being sick. I thought I would probably have some mild symptoms, if any, maybe loss of taste, but it's not just about me. It's about people I'm around. I have colleagues who are older, who are in a higher risk category, who go home to their wives who are older, or their husbands, or their grandparents who are at risk. So it wasn't just about me individually. I'd be like, yeah, I'd just rather get sick. Let me, but really, you don't know who it's going to affect. And I don't know that it would have affected me in a mild case. That's just an assumption. So that being said, I had to be a pillar of the community. At some point, somebody had to get a polio vaccination. At some point, somebody had to get tetanus. And these are childhood infections, diseases, and Dr. Clemons can tell you more about it than I can, that those have been eradicated, thankfully, to vaccinations, your MMR. I'm so grateful for it. So my personal journey was that I needed to take a stand. When we think about which people are most affected, it is people of color, people with risk factors. And so they are people that look like me, people that I take care of every day. And I have seen sick moms, sick pregnant women come in, have a baby, and die 2 weeks later. It is not okay. If we can do something better to help our community that is mostly affected, we've got to dispel these myths that it's got a tracking device in the vaccination. No. That's a whole nother journey we can really go into, is, healthcare and myths, and also distrust of healthcare when it comes to people of color because of things that have happened historically. We won't go into that, but we definitely have to make sure we are getting the facts, getting educated, and talk with your personal provider regarding your risk for COVID versus the vaccination. But I think we have to protect ourselves.
Absolutely. We definitely have to protect ourselves. Thank you. Thank you, Dr. Strozier. And that actually brings us to our next guest, Matthew Conte. And he is a principal investigator in viral genetics and emerging diseases for the viral diseases branch at Walter Reed. So, Matthew, are you there?
Hello.
Now, Matthew works on monitoring virus outbreaks. And I know you're going to receive the vaccine as soon as possible. So you are an authority who can speak to the research that has been done on various different types of diseases. So, one thing that, a lot of people have a question about is, why is it suddenly we have a vaccine for this and it's only been around for a few months, and there are all these other diseases that have been around for years and nothing has been done. So, Matthew, please share with us your knowledge and expertise.
First of all, I just wanted to thank you for inviting us to be a part of this. It's a great chance to speak to the community that, you don't often get. So happy to answer as many questions as I can to the best of my abilities. So, this is obviously a once in a lifetime pandemic here that we're, hopefully past the middle of. And there's a number of reasons why these vaccines have come along in such a short time. So obviously one of the biggest factors is the amount of money that has been dedicated to this effort. Obviously, Operation Warp Speed, as everybody's familiar with, but beyond that, there's been tons of private investment into this as well. And so that just allows things to be sped a lot faster. The other major factor, I think, in getting these vaccines to the state that they're at right now, which is past a phase 3 trial, they are in emergency use authorization. So they're not completely approved by the FDA. They're approved for emergency use. And so, yes, we may not know the long-term side effects of these vaccines at this point. However, these mRNA vaccines have actually been in development since the 1990s. I think the first studies were done in animals in the 1990s. And there's been, as Dr. Clemons mentioned, many studies, especially in cancer treatments, but as well as in infectious disease, HIV studies. So, many mRNA vaccines have been put into human arms for many years. This isn't that new of a technology. It's just new in that we're going to give it to many more people. And, unfortunately, those trials of the Moderna and Pfizer vaccines went quick because we had so many people who had COVID. And so you're able to actually get the statistical numbers that you need to be able to show that it's effective and it's safe. And so, to be able to do that quickly in a pandemic is one of the other major reasons that this has happened so rapidly. Thank Wanda for giving her story. I'll just add a little bit to it. I don't know if she wanted to share this part of it, but I'm going to anyway. She was in the hospital for a while, but after that, she was actually, she had some mental side effects for months after that. And thankfully now she has passed that. But, if this disease doesn't kill you, it doesn't mean that it's not going to affect you, and you're not going to have long-term side effects. And so that's another, oftentimes perhaps people may forget that aspect to this disease. So I just wanted to kind of make that aware.
Okay, thank you, Matt. Thank you. Let me ask you a quick question. Now, I know that when you were sharing before, you were saying that this isn't, some people, this isn't brand new. So, we've had Ebola, we've had SARS, we've had other viral diseases. So what makes this one so different from the others? Because this is what you do, you study diseases and their evolution. So can you speak to why is this one so different?
Sure. So without getting into the weeds, even though I'm actually in the weeds in my background here, if I get too far into the weeds, stop me and say, we don't understand you. But yeah, so there was the first SARS outbreak, which was a much smaller epidemic, but the virus itself is similar to the current SARS-CoV-2 outbreak. And so there's been a lot of study on, we're going to look back at this period of time, and it's just amazing the amount of different work and scientists who have pivoted what they were working on that had nothing to do with viruses and are dedicating their efforts to research in COVID. And so we're learning new things weekly, every day, basically. There's a new story, right? You see something. Mm-hmm. And so it's a moving target. But what we do know is that, this virus actually has, a latent period somewhat. So you can contract the virus and actually, feel fine for several days, kind of like Wanda did. And then there's a period where you can spread the virus for, several days without showing symptoms. And so that's what makes it really difficult, is that you don't feel sick, but you're spreading it. And then several days later, you do feel sick. And I think that's actually one of the hardest things about this virus is that, you're able to spread it either asymptomatically or pre-symptomatically. And yeah, it just sets up a situation where it can spread like wildfire.
Yeah, that makes sense. And so actually that leads us to our first chat question. Thank you, Matt. Thank you so much. That leads us to our first chat question, which is directed to Dr. Clemons, which is vaccines work via herd immunity. And anyone can answer after Dr. Clemons as well. Vaccines work via herd immunity. It's less about individual decisions and more about how we protect the community, right? And that is from Chandra Garber.
So you're absolutely right. You know, like I said, I don't want anybody to kind of twist what I'm trying to say. I just want to be very clear. I am for vaccines. But part of what we're discussing is the fact that we just don't know about these vaccines. And what I want to be careful with is that we're going to turn to this vaccine. And I respect your experience, Dr. Conte, on that, saying that mRNA has been around for a while, that form of vaccine, but it hasn't been out in the public in large masses and large numbers where it's used for preventive purposes to prevent preventive illnesses. And that's what we're looking at. In terms of herd immunity, of course, it's herd immunity is basically saying if I immunize, you know, there's 1,000 people here and I immunize, you know, 950 of them, that we will indirectly protect those other 50 by essentially almost like eliminating the virus. And herd immunity is important. I think we've done a phenomenal job of vaccinating the general public. That's why Dr. Strozier was saying that we have actually eradicated a lot of various preventable diseases, you know, by doing a phenomenal job of immunizing. So again, I do believe in vaccinating, but what's different with this particular vaccine that many people don't know and the general public is not familiar with, unless you're a scientist or, you know, a physician who's been doing it for a while and that's all you do are vaccines, is that this type of a vaccine is actually, first of all vaccines are pretty much dependent on your immune system working. That's just number one. Your immune system doesn't work, vaccines don't work. It's just that simple, okay? So this one is based off of the expectation that your body is going to uptake this mRNA, make a copy of the protein that is on the coronavirus, and then your body is going to synthesize antibodies to attack that virus. So what I say when I say we don't know is that, you know, of course, my hopes and prayers is that these vaccines that we have come up with will do just that. But we don't know if it's going to do that, if it's going to essentially, you know, turn into some aqueous solution where it just almost has a placebo effect and the body doesn't respond at all to it, or if it's going to synthesize another protein. So this is why I'm saying it's not to be selfish. You know, you have to understand, I've been doing this over a couple of decades. I'm around probably what I call walking organisms, children. That's how we all get sick. They just spread germs everywhere. And so I know the importance of immunizing. Like I said, I've been immunized. I've immunized my children as soon as I got a chance to. But I think we need to also be very careful with expecting what happens if this vaccine doesn't do what it's supposed to, and everybody is comfortable thinking that they can, you know, not hand wash and not respect social distancing. And then we end up spreading it more because the studies I've seen saying it's been as effective from 50% to 90 something percent. So I wanted to be clear, it's not a selfish decision, you know, for me or anybody else to think twice about putting something that we just don't know about into our body, you know. So that's where I say with anything that you do, including myself, you know, I weigh the pros and the cons. Had this been a vaccine that we've been using or that we have lots of data on, we have lots of experience on, not just on animals, you know, but just from people in general, I would say everybody run out immediately and get it done ASAP, but we simply don't know.
Okay. Okay. That's very valid. Thank you. Thank you. I appreciate that. And, you know, we do have some very special guests on our sub panel. We have Dr. Peters. Dr. Peters, are you there? She is an African-American dentist. And And actually, Taliba Carr just said, thank you, Dr. Clemons, for being an independent thinker.
Thank you.
Dr. Peters, are you there?
Thank you for having me. I'm Dr. DeCandria Peters. As you can see, I'm a relatively young new dentist. So yes, we as dentists are able to administer the vaccine. We do have to go through some training with the CDC, just a couple of courses. But I mean, as dentists, we're giving shots every day. So we have to know the anatomy of the body. Even though we are working in the mouth, we still know the other parts of the body too. And we're just trying to do as much as we can to help get this vaccine out and COVID under control. I do have, I mean, COVID hasn't affected me personally, but I guess I do have a little story of my own. So COVID hit while I was still doing a residency. So, you know, we had to slow seeing patients down a little bit just until we were able to screen our patients and make sure everything was safe, have the proper PPE, all that stuff. So after I finished my residency, you know, I started working in private practice, and, you know, COVID's still a major problem during all of this. You know, a lot of dentists have closed their offices because they're afraid that somebody is going to catch COVID. A lot of patients aren't coming into their appointments because they're afraid that they're going to catch COVID at the dentist's office. A lot of assistants and hygienists don't want to work right now because they're afraid that they're going to catch COVID. So it's really important that people get this vaccine. You know, I personally have gotten the vaccine. I got it last Friday. I got the Moderna vaccine. I only had, you know, the sore arm. I didn't have any other issues with it. My dad coincidentally got the vaccine that same day too. He didn't have any issues with it, but his coworkers, they actually, some of them ended up going to the hospital because of complications. So, you know, you, like the other doctor said before, you have to weigh the risks and benefits. We really need to get this thing under control. We had an assistant at one of our offices. She caught COVID, and funny story, we were working on a patient, and you know, we were making small talk with the patient, talking about COVID, and the patient's like, oh, I don't believe in COVID, like it's just a myth, like it's not real. And the assistant's like, oh, like I agree with you. Same assistant, like a couple weeks later, caught COVID.
Wow.
Yes.
Wow.
You know, she had some pretty severe symptoms. We had to get her to test negative before we had her come back. But I talked to her the other day when she actually came back, and she was like, oh, like, I really believe in it now. I was so foolish then. I wasn't wearing my mask. Like, I wear my mask all the time now. Like, I'm trying to, like, make sure everybody knows, like, how serious this thing is.
Yeah, it is very serious. Now, I remember when we were talking last week that you said that you had to get special training.
Yes.
To give the code. Can you speak to that a little bit?
Yeah, so really all it is, we go through some CDC training. So it's just a couple of videos for us to watch and to, you know, review the information on each vaccine, you know, where in the arm to give it, you know, the details of the vaccine, like when you need to schedule your second appointment, stuff like that. So,
okay.
Yeah.
Well, so you are now qualified to to give the vaccine.
Yes.
Now, well, so I guess, well, a major question is going to be, so let's say I need to get well, I do need to get that, but let's say I'm coming to get stuff done on my teeth. Would
Yes.
I be able to say, hey, can I schedule to get a vaccine at the same time that I'm getting work done on my teeth? Is it something like that? Or has a plan been implemented just yet for dental offices?
Right, so a specific plan hasn't really been implemented for the dental offices. It's up to the dental office. So you have to set up your dental office to be able to administer these vaccines. Some of these vaccines have to be, stored in a fridge at negative whatever degrees. And most all dental offices don't really have that. So you have to set up your office specifically for keeping those vaccines stable. And if you're able to do that, then yes, like you come in for your appointment, you probably be able to get your dental work done. And if you choose to do so, you could get the vaccine the same day. That's how I would imagine it working out.
Okay. Well, Dr. Peters, if you want to put your information in the chat, perhaps people may need a great dentist. I highly recommend you. And thank you for sharing your information. And please, if anyone has any questions directly for her, just put them in the chat and I will ask them of her as well.
Thank you, guys.
Thank you. Now, I have a question from Felice Hughes. Well, actually, first, Dr. Katherine, you wanted to say something?
There we go. Okay, great. The meet's on. Okay. Yeah, I just wanted to kind of just comment on something that was said earlier about the vaccine and, us not knowing the efficacy yet. Nobody would recommend that just because you get the vaccine that you stop taking precautions. I've actually, because of this new variant that's supposed to be even more virulent and they don't know how it will react with the Moderna vaccine. So I've started wearing N95s routinely now. And that's just in the last couple of weeks, even though I know I have the vaccine. So I just want to make sure that it's clear that just because you get the vaccine doesn't mean that all of a sudden you're, zippity doo dah, free to do whatever you want. I'm still taking all the precautions. I'm still trying to stay away, from large groups and all those sorts of things. So I think that's really important. I mean, I'm looking at, total numbers of cases, in, my area and in the United States as a whole. To be my cue as far as like when I can, quote unquote, rejoin society. But, the way that things are right now, I mean, I'm still tamping it down until, things improve significantly. So I just want to make that clear that it's not like a cure all. It's 94% effective, which means that it's 5% not effective. So
the vaccine is not a get out.
I'm sorry. Still a 1 in 20 chance you're getting it. So if your caseload's really high, there's still a chance you can still get it if the caseload's just so high where you are. So I just want to make that clear.
Wow. So like, for example, here in California, a couple of days ago, we were up to 400,000 deaths in the state, which is kind of insane. And so we're ramping up the vaccine. So basically a lot of people are thinking, oh my goodness, yes, I get the vaccine. Now I can go and live it up because I'm immune. I am a super person.
Yeah, and as my mother said, I mean, they got sick even though they were being careful. So it's really just another line of defense in addition to masks.
So even after the vaccine, we still need to be protected. That's what you're saying.
But you want to have all the protections. You don't want to just have one, and then should that fail, then you have nothing else. You want to have all the protections with you. So yeah.
Well, that speaks to the question from Felice Hughes, who's a middle school teacher, and she will eventually return to the classroom. She wants to know how safe will she be with students if they are not vaccinated? Can anyone speak to that question? Anyone?
Hi.
Okay. Hi.
And OBGYN over here, but I would like to say that first and foremost, we know that children usually are more asymptomatic carriers. So when we think about that age group, to me, they're the biggest bug carriers. And those teachers who are at most high risk for any kind of susceptibility to infections, being over the age of 65, having other healthcare issues such as diabetes, high blood pressure, obesity, other airway illnesses, they are going to be at risk. So when we're looking at the next phase after your healthcare workers, your emergency people, the teachers are going to be most recommended to have it because they will be really in close proximity. The children are not recommended to have vaccination. I think that the guidelines are 16 and up because they have seen where that later age group of teenagers can have some severe illnesses similarly to adults if they have other risk factors. But for children, you know, their course, they may not even have symptoms, but they are going to be at risk. I think even in returning to the classroom, there are a lot of schools that are already open. There's still going to be regular precautions that are going to be practiced for cases, schools that may have not reopened already. I'm in Georgia, and our children returned to school. There was a staged, staggered return into school where you limited the amount of students that were coming in at one time, especially when you reopen, you might have the younger groups that don't know where they're going. So they had very strict precautions on how the children would come into the school. They changed a lot of the ways that children did their food. So lunch is different. You don't have an open line. Children get their prepackaged meals and they don't sit in a cafeteria all exposed to each other. They're going back to their home classroom and even in their individual space. And, you know, we still don't know a lot about what's going to happen for the rest of the school year and leading into the next school year. I'm pretty sure Dr. Clemons has more guidelines coming from the pediatric field, and she could probably give you a little bit more evidence on that. But if you are at risk, which adults are at risk, when you're around a large group of children that are likely 90%, if they are a carrier, if they've been exposed to COVID, they likely will not have symptoms, but they will be very contagious.
That's good to know. That's good to know. You know, someone very close to me who she is an RN and she just recently received the vaccine. And she was sharing something very, very interesting that I had not considered, in that as medical professionals, and all you doctors can speak to this, as medical professionals before the vaccine, you were, even though you were protected, you were going from room to room, from patient to patient. And she obviously got the vaccine now, but she realized that a lot of times unknowingly, unwittingly, and unintentionally, that from going from room to room to room, that could pose a significant threat of transmitting COVID unknowingly by the healthcare providers, which is why it was a lot of ways discouraged for people to go into hospitals. So once people went into hospital with COVID, then outsiders weren't allowed to go in because of not just the amount of patients that were in there, but because of just is that true? I mean, that's what she said.
I'll speak to it again. And anybody, please feel free to chime in. I'm just on it because I know how when the Zoom is, if you can't click unmute, it's kind of hard to answer a question. But because I'm still unmuted, I will say initially, that was a very, very valid concern. When we've started hearing about our first cases of COVID, unlike any other pandemic, endemic that we've been talking about, we as healthcare providers were privy to guidelines. We were warned. We had, I'll just use Ebola for an example. I had so many flyers, H1N1. We got so much information from our national governing bodies, the NIH, the CDC, and COVID. We knew about it. We heard about it in other countries, but this hit us so differently. And the preparation to me was not what we would have expected, even as healthcare providers. So we immediately had to put some pauses on people coming into the hospital. Most hospitals changed guidelines. Most office practices changed guidelines where people had to be pre-screened before they even came into the common spaces. People were given masks when they came into the hospital. We made immediate changes to the acuity of office visits as an OBGYN, clearly, I can't just stop seeing every patient. Women are bleeding, women are having babies, but we prioritized who needed to be seen. The emergency room, there were sick patients that were placed in a different isolation area if they had respiratory illnesses versus people who had non-respiratory complaints. So there were immediate measures that were taken and additional cleaning. But in those early phases, you're absolutely right. I would have been terrified to go anywhere until those precautions were made. But now I feel like coming to a doctor's office, coming to a hospital is probably cleaner and safer than going to your public grocery store.
Wow. Wow. Thank you for that. That's good to know. That's good to know. We have a local doctor to Los Angeles, Dr. Joseph Pearson. Dr. Pearson, are you on? Okay, well, while Dr. Pearson comes on, I'm going to ask a question from Calabrisco. And this question is, I have a chronic autoimmune disease similar to Julian Bari. Are there conditions for which the vaccine is not recommended? Anyone can speak to that.
I'll speak to that in terms of, even though, you know, like I said, I think everybody needs to just do their homework and, you know, make the best decision for them and their family. In terms of the contraindications at this point, and somebody else can chime in as well, but my understanding, the major contraindications, of course, if you have any type of adverse reaction, if you have a history of anaphylaxis, severe allergies, those type of reactions, those are, you know, right now the only contraindications. Pfizer's is, you know, indicated for those 18 and above. Moderna's vaccines indicated for those 16 and above. So outside of that, you know, you should make sure that you actually just stay in direct contact with your primary care physician who can weigh the pros and cons. And, you know, like I said, for everyone, you know, it really depends on your immune system, your health, overall health situation, to determine what's going to be best. And in terms of, you know, the biggest trick, and a lot of times people don't even realize the barriers with this, is that as physicians, we always have to make those decisions. We take the Hippocratic oath to do no harm. And so when people are worried that we're actually going to spread it, you know, you have to make that decision. Do I take that chance, or do, you know, you do the best. You take all kinds of precautions. You put your mask on. Some people are saying we're supposed to double mask. You glove up, you sterilize as much as possible. But when you're looking at something that's so microscopic, like it's just blowing in the wind, you know, how much can you actually prevent the spread of it? And so I rely on heavily, this is why I am a stickler for, I'm a minimalist, and I believe in primary care, staying healthy. Part of staying healthy is eating right, sleeping, keeping your stress level low, right? Hydrating. When you do those basic things, you'll be surprised at what it does for the immune system. So when we all stress out, when we don't get any sleep, when we do a lot of different things we're not supposed to be doing, it suppresses our immune system. And even if you do get the vaccine, how effective is it going to be? So we can all do the best that we can to protect ourselves. But remember, as physicians, you know, we took an oath. You know, do I sit in a room, sit somewhere across from somebody when I know that child has stopped breathing, and say, oh, let me make sure I put everything on, because I have to think about, at the end of the day, is it going to be more responsible for me to, and as a person, I'm a human first. Will I be able to live with the fact that I have the training, I have the knowledge, I have the skill set to save that child's life? Or do I say, okay, you know what, I didn't get the right size mask. Okay, guys, go give me the N95 and take that chance. This might be an extreme, example, but this is what physicians, clinicians have to decide upon every day and all the time. Every time we interact with our patients, with our staff, do I continue to see patients, right? And or do I just keep all this knowledge and information that I have to myself because I want to protect myself and not expose my children and my family? So it's a really tough situation for all of us to be in. But please trust and know that we are doing our best. And some of us that, came around, I trained at a time where we did 100 and 120 hours a week, working, literally. And so there are some people who may not necessarily, glove up exactly at the right time, but you always have to make the right decision that's going to be in the best interest of the patients. And so again, I can't stress enough how important it is to maintain your health. Anybody like me, like I said, I'm exposed to the sickest ones all the time and walking germs. But like I had some families say, Dr. Clemons, you're never sick. I'm like, yeah, because it's almost like my immune system is like steel. I've been exposed to everything that you can imagine. But I'm also OCD about hand washing. I wash 2 to 3 times for every patient that I see. I wash before I touch them. I wash them while I'm explaining what's going on. And I wash when I leave the room, because not only is coronavirus out there, but there's so many other viruses that we cannot see. And this one is just the virus of the time. But there's so many other viruses out there, bacterias and fungi that can be, almost deadly to some of us. So if you make sure that you exercise the proper precautions every time, I don't think that anybody has a certain look to a disease. I do it every patient, every interaction that I come to. And I teach my children to do the same thing. So I'm sorry I got a little bit long with that. You can see I'm very...
It's okay. It's okay. Thank you. It's very important. Dr. Pearson, are you on?
Of course. Thank you, Ms. Gay. I want to thank you for the invitation to join your tele meeting, your virtual town hall conference, and I'm appreciative of that. The word needs to get out to everybody that this vaccination process is very important and necessary. In my opinion, I've been in practice close to 30 years. And as you see, I'm here at the job. We just finished a committee meeting here at the office. I've got Dr. Kate McGill over here. He's joined us tonight. But to say that, I'm asked this question often by my patients, and I advise them, if you get the opportunity to take this vaccine, then take it. In fact, I've had a dose myself, the first dose about 2 weeks ago, waiting for the call back to receive the second injection. It's my understanding that there's a backlog in the vaccine, but the current administration at the White House is making progress in getting this vaccine out and making it available in a stratified way for us. But I tell my patients, and I have mostly seniors in my practice, I still advise them to get the vaccine, though there are reports that there's a higher incidence of adverse effects in individuals 85 and up, 75 and up. They lowered the recommendation to receive the vaccine to about, I suppose the cutoff age is about 75 now. Frankly, I had very little in terms of an adverse effect when I got the vaccine, just a little soreness at the shoulder. But I remember when coming into practice at UCLA, when the AIDS crisis emerged, and we were all terrified of what's happening. And this is the same. This feels the same to me. And we're trying to make an impact as heartily as possible. And I believe that it's important to weigh the benefits of receiving the vaccine over the risk. There are reports that there may be adverse effects where from a systemic allergic reaction to a local reaction at the injection site. However, you're made to sit there and you're monitored for at least 20 to 30 minutes for adverse effects. And I tell this to my patients. If you have the opportunity to get the vaccine, then by all means get it. And every precaution is taken to guard your safety. But Dr. Gill had a question he wanted to ask.
I just wanted to piggyback on some of the previous speakers. First of all, I want to commend the doctor in the weeds that this vaccine, this messenger RNA has been around been experimented for quite a while, and it's not really new. We just use a new technology for that for the vaccine right now. And as far as Dr. Clemons is concerned, I appreciate her concern about the reluctance about people getting the vaccine, because historically speaking, we heard about the Tuskegee experiment, and our folks are very reluctant to take the vaccine. So my job is try to allay some of their fears in making sure that our patients are vaccinated, and also the HeLa cells, the cervical cancer cell that is being immortal, that's from a black patient. So we have concerns about the vaccine, but I try to emphasize, as Dr. Pearson just said, the benefits outweigh the risks. And also in reference to the pediatrician, in reference to children, I'm family practice, and I say I treat people from the womb to the tomb, but not the soon to the tomb. So as far as the pediatrician is concerned, the children basically, they are very resilient. And as far as them giving the disease to other people, it's the other way around. The family member, the older patients, giving the disease to the children. So I had my second shot about a week ago. I felt fine, and I had so I am doing pretty well. So I use myself as an example to emphasize to my patients to take the vaccine. And we have a very unique problem in Los Angeles here. We are so very crowded. We're a crowded community, and people live in crowded communities, and they are more prone to develop, COVID-19. So I want to commend all of you folks for your contribution, and we have different views, and we accept these different views, and we all are fighting this common enemy. So all hands on board. Thank you very much.
Thank you for your contribution. Thank you so much. There's a question, Dr. Pearson, for you in the chat that we can come to in just a moment. I have a question that either Katherine or Matt can answer. The Moderna vaccine contains mRNA, which alters users' DNA. This is the first mRNA vaccine. And the question is, will mRNA rewrite an injected person's DNA?
Well, from what I understand, it's all about what comes of the random clinical trials. And from what I understand, there are protective antibodies that have come about as a result of the vaccine, as a result of being vaccinated. And but the question is how protective these antibodies actually are. These are being studied. From what I understand, the question has been answered that people are protected.
Okay.
It's the RNA vaccine.
Mm-hmm.
Well, it's new.
You mind if I jump in, Dr. Pearson?
Yes, go.
So
Yes, go ahead.
The first part of that question mentioned that the RNA vaccine will integrate into our DNA. Did I hear that correctly? Okay.
Yes, so the statement was the Moderna vaccine contains mRNA, which alters users' DNA. This is the first mRNA vaccine, and this is a statement from this person. And so the question is, will the mRNA actually rewrite the injected person's DNA?
So I think I misunderstood the question. No, the person's DNA is not altered to the extent that there's ultimately the production of antibodies that are made that are effective against the viral spike protein. But the host DNA is not permanently altered in a bad way, from my understanding.
Can I tell a quick?
But Dr. Gill has a.
Sorry, Matthew can talk to that. This is actually what he does.
Just to comment on what Dr. Pearson said, when the messenger RNA gets inside the cell, it's a very transient phenomenon. It is degraded very, very soon. So it has no ability to integrate with the person's DNA. So that's a fallacy altogether. It's a very transient phenomenon. It does its work, it's good work, and then disappears from the body. So there is no chance of it being integrated in a person's genetic makeup.
Okay, thank you. Matthew, can you speak to that as well?
I would love to.
Okay.
I
Go ahead, Matthew.
Tell a story about the scientific world that we live in currently. And there are scientists around the world that are working very hard on this, as are all our medical professionals working around the clock. And part of the scientific process is that, you present a study, your results, and it gets peer reviewed by other scientists. And one of the drawbacks of that is that it takes time. And in this particular case, there's been many what are called preprints that are studies that are not peer reviewed by other scientists that are posted. And so this is both a blessing that you can receive these new results very quickly, but it's a curse at the same time because other professionals have not had a chance to rigorously review that work. And so I'm guessing that this person's question actually involved a particular preprint that I believe, I can't remember the exact title of the preprint, but the extent was that they showed that this mRNA had inserted into a piece of DNA. And that, without getting into all the weeds, because I'm not going to teach you molecular biology at 10:45 p.m., but it seems to be that the scientists who wrote that paper, it's just an artifact of how they went about doing that. Okay, and so it does not appear at all that the mRNA vaccine can integrate into your DNA. So they were putting things like integrase genes into it, which well, I'm getting into the weeds here, but yeah, no, it does not appear that it can integrate into your DNA. The mRNA stays outside the nucleus where the DNA is stored, is translated into the protein, the spike protein, and the mRNA is degraded very soon after that, as Dr. Pearson mentioned. So, all right, next question.
Okay. The unmute button strikes again. Okay, thank you, Matthew. Thank you so much. We have just a couple of more questions. And one is from Annie Richardson, and she says, during vaccine trials, what is the threshold for determining that it is effective enough to be approved? And anyone, please answer that question. So it's during vaccine trials, what's the threshold for determining that it is effective enough to be approved?
Sorry, I couldn't get my thing unmuted fast enough. Yes, so generally the FDA says a vaccine that is over 50% in the US, a vaccine that's over 50% effective is considered successful. So actually your typical flu vaccine is only between 50 and 70% effective, which is why some people, when they get the flu vaccine, still end up getting the flu. So all the vaccines that we have right now, both Moderna and Pfizer have far exceeded that expectation. In addition, I saw somebody in the chat did ask about the Johnson & Johnson vaccine, which I don't know if we have time to go into it completely. It is effective. It's effective by FDA standards, and so will definitely prove useful. It is not as effective as the other ones, but it is effective by FDA standards because all of it is kind of like, again, a combination of just trying to lower the number of people who get it so that the disease can be eradicated. So none of them have to be 100%.
Okay, thank you. And thank you for answering that question. Yeah. And so one last question that is a myth that I would like to be debunked is that there's a rumor floating around that that the vaccines make African-American male and female, especially children, sterile. So
first of all, I mean, I'll just say that real quick. They have not tested it in children. So no. But I'm sure so first of all, why would you know that children are sterile anyways? Because they're children. So that part doesn't make any sense. But probably Dr. Strozier can speak to the fact that people are able to conceive and have children with the vaccine.
Okay, thank you. Thank you, Katherine. See, it goes to these rumors. The rumors, if you just really think about them, they really don't make sense.
I mean, I think the most important thing with that is that, the vaccine does not affect that part of the body. So there's actually no, it can't get down there. So I don't know, Dr. Strozier can talk more about it. That's her area.
Yeah, it doesn't work that way. This is not targeting any reproductive organs. And trust me, we've been living in a pandemic and people are still getting babies. People are still getting pregnant. No, trust. There's no shortage of deliveries these days. This is supposed to be when eggs kind of die off a little bit, but we still are in our baby boom season. So no. And I do look forward to getting more information as patients who are pregnant, who have had the vaccination, report any symptoms or any concerns. But I can tell you though, if you have the opportunity to get the vaccination before you conceive. Now, there is some concern. Is there a waiting period? We don't have all the facts, but I can tell you for people who have gotten COVID during pregnancy and have severe symptoms, we have seen growth restriction. We do know that it crosses the placenta and it has affected the placenta for some patients, causing placenta abruptions, which can affect if your baby can become a stillborn or if you come in hemorrhaging. We have seen some severe cases. So it is something that we still need more data, but it's definitely not interfering with reproductive people getting pregnant, conceiving. Yeah.
Okay. Thank you. Thank you for answering that. And we do have one, and I don't know if she's still on, Kendra Shea Dove. She is a pharmacist, and there is word on the street that pharmacists are now going to be able to give vaccine shots. And when I shared that information with someone, they said, well, I need them to focus on my prescription, not worry about giving shots. So Kendra, Shay, Dove, if you are on the line, if you're on the call, please, if you could try to unmute and respond. If not, that's okay. We do have one final one. I promise this is it. And if there are more questions, please feel free to email us. I'll give you the email at the end. And if we need to have a part 2, we can totally have a part 2. But this will be our final question, for real this time. Is it true that Black people have a different cellular response to synthesizing an RNA messenger protein than non-Blacks?
I haven't heard it. No.
Never heard of it.
I never heard of that. I never heard it. That's novel to me. But I have a little comment from a universal point of view. This is a pandemic, so I'm just wondering what's happening around the world. I know there are several vaccines available: the Russian vaccine, the Chinese vaccine, etc., etc. And if you want to contain this pandemic, it's crucial that the entire world should be vaccinated. The world is a village right now, so I'm just wondering how we are addressing that issue in reference to this global issue.
Right.
Comments?
And I was just going to say, as far as the mRNA, I think it was what they said, the metabolism of the mRNA.
Yeah.
Different.
So is it true that Black people have a different cellular response to synthesizing RNA messenger protein than non-Blacks? So is that unique to the Black culture, Black immune system?
There's a lot of reasons why. So part of my research is in evolutionary biology of people. First of all, this is a whole nother conversation, but the line between someone being Black and non-Black is gray. It's really gray. So you can't make blanket statements, that are, that our bodies work so much differently because there's so much variation within the Black community. And that's a whole nother issue. But I would say that, if you think about everything, food, everything that we eat, everything that we do, most things in humans are fairly universal. And we react to things fairly universally. Something getting down to the cellular level is metabolizing mRNA. I don't think that would be a problem, but again, this is why they tried to make sure they had representation in the trial, specifically for this reason, because they wanted to make sure that there was no difference. So they didn't think there'd be a difference, but they definitely made sure. And these trials, again, these vaccine trials, they haven't only been done in the US, they've been done in, South Africa, Brazil, the UK. So they're looking at, a pretty diverse range of populations to make sure that's effective in all populations. And they haven't found any differentiation in any populations. So that really is the big test, is if, what happens empirically. Yeah.
Okay,
and
thank you.
If I can say one thing about that too, I just want to talk about the fertility issue too. And I understand that, our community is, really reluctant to trust. And it's not like we're just crazy, things have been done to us consistently and they still are, so, but our genes, our genetic component makeup is pretty much the same, like Dr. Conte said. But the things that might be making people feed on some of these rumors are, some of the other factors that have not been equally weighed in, and that's the disparity of treatment of Black people in the healthcare system. I think Dr. Susan Moore, if many of you have had the opportunity to see her videos, of this physician basically begging for appropriate care, sadly, she's not the first and she's not going to be the last one. And so that becomes real. But I think what the most important thing is, not to be anti-doctors, medical community, but make sure that you're just in touch with, a physician that you trust, who's going to tell you straight up, in terms of what should be done. And because at the end of the day, if I tell you something and you don't trust me, it doesn't really even matter. But if you trust me so that when I tell you, you need to get this done, you're going to get it done, then I think ultimately everybody benefits and they win. But there are so many factors. Our genes are no different. Even though the medical community has treated us a little bit different, you have you have to have a high level of GFR before we treat you for renal disease. Your PSA level for prostate, disease has to be higher before we actually treat you. Someone may use a calcium channel blocker before a beta blocker. And so, at the end of the day, it's still based off of studies, but we're all human beings. That's it. The human race has the same genes. We can look at maybe our derrieres are a little bit thicker, but we still have the same, the three muscles in the gluteus, maximus, minimus, and medius. You know what I mean? So, even though some of it might be fearful, we might be frightened. And I think as time evolves, we'll have more answers. Just like I know we need 5 tetanus. At one point, we maybe started off with 2 shots. Now we know we have to have 5 to have appropriate titers. We have to have 2 measles. Originally, we started off with 1. Then we knew we had to have 2. And so as we start to study this and it starts to evolve, we'll have more answers. And at the end of the day, what I want to leave, since most people are thinking that, I had a very unpopular perspective, my eyes just go wide open in terms of when you start talking about what's going to be injected into the body. At the end of the day, if you have high risk factors, high blood pressure, COPD, any kind of lung disease, you're 65 plus, you are obese, morbidly obese, I think you need to run to get a vaccine. That's my take home message, right?
Okay.
And that's it. But thank you so much for having me, and I appreciate everyone's attention. And to all my colleagues, I salute you. I applaud you for all the hard work that you're doing, because these are some trying times for all of us. And they think we're superheroes because we have MDs, PhDs behind our names, but we're still just people trying to make the right decision for the community, for ourselves, and for our families. So thank you, everyone.
And thank you. And for real, this is the last one. Hank Aaron suffered. They keep coming. We're gonna have to have a part 2.
Part 2.
So this is the last one. Now, Hank Aaron suffered a stroke after receiving his 2nd Moderna vaccine. So the question is, how can an injected person not experience a secondary effect and perish?
Tough question to answer. I think
Unmute there.
I think the vaccination has.
Dr. Pearson, can you move the camera over so we can see you, please?
I believe the vaccine administration and Mr. Aaron's death are coincidental. That's my personal thought. I believe one has nothing to do with the other, but who knows what the autopsy shows.
Yeah, I was going to second that. He was, 96 years old, I think.
Yes.
Yeah, we don't know that it was caused by the vaccine. But both my grandparents were 96 years old and they got COVID and did not survive.
Well, and you know what, to that end, my grandmother is 99.
Yes.
And she got the vaccine 2 weeks ago. And her questions to me are, Millena, when are you coming this way so we can go back to the club? Because that's actually what we do. We go to the MGM Grand Hotel and we go to the nightclub, and she wears heels and I wear flats and we boogie down literally in the club. And so she wants to know when I'm coming back to do that. And she's 99. So
go for it.
There's that.
And I just, Millena, wanted to jump in and say that I like that question. And again, I went to art school, I went to library school, so medicine is for sure not my expertise. But again, just to jump back onto this idea that I really try to push, which is to always be critical whenever you are being presented with information, right? Again, someone, and I don't know why people send me these texts because they know I'm going to fact check it, but someone sent me a text and there was a Facebook video going around with a woman who was having like constant shaking after allegedly taking the vaccine. So, you know, of course I was like, oh, sigh. So I started reading about it. And again, so my expertise is not in medicine, but I can read, right? And so vaccines and the medical professionals can stop me at any time if I'm wrong. Vaccines, the side effects are generally the same kind of side effects you would have if you actually got the disease or the infection itself, right? They're immune responses. So yes, you could have a seizure, right? Yes, you might have a fever. Yes, you might feel nauseous or dizzy or fatigued. These are all things that go along with getting a virus, right? Constant shaking nonstop all day long, that's not that, right? And I remember again on the family call, Katherine saying like, you know, some people died after taking the vaccine because they got hit by a car. And I think it's important, it's important to like remember that correlation is not causation. So just because two things happen at the same time does not mean that one was caused by the other. So yes, this 96-year-old person, and forgive me, I have no idea who these people are because I don't watch TV. I live under a rock. But this person happens to get a vaccine, and at the same point in their life, something bad happens to them. It is easy to put those two things together. But again, I just always urge caution when taking in information. And again, this is what I share. I literally shared a whole like mini essay on why this was improbable. And, you know, just when you're receiving information, just remember that that's exactly what it is. It's not just your friend telling a story. It is you taking in information. And I feel like, again, many people have talked about our personal responsibility. And I feel very strongly, especially as educated people, it is our responsibility to sort of be where the rumor and the misinformation ends. So I might have heard it, but I'm not going to repeat it because I don't want someone else to get this.
Thank you. Thank you so much, Crystal. Thank you. And with that, we're going to wrap up our session this evening. Thank you so much for everyone, all of our panelists. I appreciate you from the bottom of my heart for giving your time and sharing your expertise. Matthew, Katherine, Crystal, Dr. Pearson, Dr. Peters, Dr. Strozier, Dr. Clemons. Thank you so much. And I know some people would like to possibly keep in touch with you and get in touch with you. You can simply just, you know what? Why don't you go to our website, therobeytheatrecompany.org, and just go onto that site, scroll around a little bit, but hit contact us and just say, I'd like their information, and we'll gladly give it to you. And as a matter of fact, while you're there, if you'd be so kind as to hit that donate button, we'd really appreciate it because we are a community-based theater company. And we're here and we've been around for 25 years and we stay around and continue to be around because of the support of our patrons and supporters. And so no amount is too small. We just appreciate you spending time with us. And we hope you found this very beneficial and very informative. And as the chat is going crazy, apparently there will be a part 2 at some point very soon. So thank you once again for tuning in, and everyone have a fantastic weekend.